Well, thank you very much, Representative Rothfuss. I appreciate so much your leadership on this issue, as well as Dr. Winstrup bringing this very, very necessary bill to the floor. And time is of the essence, and literally lives are at stake. Sometimes you hear that discussed here, well, this bill is going to impact life. Well, this one truly does. This is a life or death matter with just a time limit. The way that this works is that the Constitution gives Congress authority over the District of Columbia. And while they can't have their own council and they can make laws, we have ultimate oversight as elected representatives of this country over what happens here. And when they pass a bill here allowing death to occur by physician-assisted suicide, we have the opportunity and we have the obligation to step in and to say, no, this is, as Representative Rothfuss said, as you said, this is the people's town. This is representative of our entire country here. And this does not represent what we stand for, that if someone has an awful diagnosis, that they are encouraged and enabled to be able to take their own life without any oversight in this. And we've got to reject this. And that's why we are here tonight. You know, the statistics are staggering. Suicide is the 10th leading cause of death across the spectrum of ages, and the death toll is sadly on the rise. Nearly 43,000 individuals took their own life in 2014. Now that's a heart-wrenching number of people, desperate and seemingly without hope, and whose situation into traumatic life situations, clinical depression, or mental disorders was to take their own life. But another, more sinister layer to this suicide crisis in America arises when agents of healing become distributors of lethal dosages. 5 states now and the District of Columbia have legalized physician-assisted suicide. The taking of human life is a criminal act in nearly every state and throughout the federal code, yet a few regions of the country, sadly, have embraced the tragic idea that it's better to prescribe death than provide life-sustaining care. And they are tasking the medical profession, those sworn to provide and take care of people. They've tasked them with carrying out this ghastly deed. So you go to your doctor on one hand when you have an illness or your child is sick, and you're asking and expecting the doctor to be looking out for your best interest and to prescribe medicine to help you get better. And then the next day, you're tasking that same physician, you're supposed to go back and ask him to kill your relative and prescribe death medicine? I mean, this is wrong. But here's another sobering fact. Legalizing physician-assisted suicide can lead to an increase in overall suicide rate, and that was just what was shared by Representative Heiss, what is exactly happened in Oregon, with an over 40% higher rate of suicide there than in other places. So if you're concerned about suicide prevention, you should be concerned with efforts to normalize doctors prescribing a bottle of pills intended to end a patient's life. Physician-assisted suicide preys on the sick, the elderly, and the disabled. The frail are the most vulnerable to rising healthcare costs, elder abuse, and physician-assisted suicide. There's no accountability should a family member, friend, or medical provider determine that a particular patient is too sick, too old, or too disabled to continue living. Any doctor can write the prescription and no witness is required. Physician-assisted suicide sheds human dignity by legally and objectively distinguishing between a life worth living and a life better off dead. The focus should be on improving healthcare options, palliative and end-of-life care for terminally ill patients, not killing those suffering from sickness or disease. So I call on my fellow members of Congress to pass the resolution of disapproval sponsored by Dr. Brad Winstrup, to reject DC's dangerous policy, and to ensure that all Americans, including those here in the District of Columbia, are granted the basic right to life. And I yield back my time.